So you're probably wondering, where are the real benefits for My Health Record? Well, I think it's reasonable to assume, and I challenge anyone in the audience to contradict this, that in the 21st century, that you as a consumer, that me as a consumer, should have an unfettered right to be able to access our own healthcare information. So My Health Record is a consumer record. It is not a clinical record by definition, it's a consumer-controlled record. There are, however, quite a number of circumstances where My Health Record works in a clinical scenario. It's particularly important, and where it's of particular value, is when you may see an itinerant patient or a new patient. Now, in the world that I work in, which is in deputising, we have a number of doctors out on the road every night seeing patients on your behalf, for and on behalf of the regular GP. We would love, under those circumstances, to be able to access your record and your practice, but we know at the moment that's not a practicality. It just doesn't happen very often. So My Health Record fills that void. Information that you and other providers send up to My Health Record can be made available to the doctors that work on the road after hours and on sociable hours. And then they can send back information either directly to you or make it available in My Health Record to other healthcare providers. So after hours is one great scenario. We know about grey nomads. Every year in the middle of winter, grey nomads travel around the country, and they travel north, particularly up to North Queensland and Western Australia. And those grey nomads are elderly, and they occasionally get sick and occasionally end up in hospitals, and information again relating to their past healthcare is not always available. So a great scenario. About a month ago, I travelled up to Port Hedland to visit my daughter who's doing third-year medicine. And whilst I was there, in the airport, there were quite a large number of FIFOs, fly-in, fly-out workers, big muscular individuals. Those FIFOs, the majority of them come from other parts of Australia, quite often from Perth. I actually visited a couple of general practices when I was there, and I asked them the question, when you see people who normally live in Perth but live here for 2 or 3 or 4 months a year, how do you obtain information about their healthcare when they're in Perth? And the answer was, we don't. And vice versa, if you ask their Perth regular GPs, you'd get the same response. That information is not shared between the doctors because it's hard to do. So for fly-in, fly-out workers, itinerant individuals as they travel around, My Health Record fills a void. And the other one, which is the one that's widely touted, is the one around saving lives in emergency departments. So for an unconscious or incapacitated patient who turns up into the emergency department where the emergency department has no previous history, it might be useful for them to be able to access the My Health Record and obtain information about their past care. And the way they can do that is by what we call breaking glass. So they can actually assert emergency access control, access that information, and if it provides useful information, it may make a difference in terms of either the healthcare delivery or potentially even saving lives. So My Health Record has a role to play in certain circumstances.